So once again, thank you so much, Cornell, for welcoming those who are joining the Health Talk today. My name is Kerry-Ann Joseph-McLean, and I am a health enthusiast, the same as my husband, Cornell McLean. We are passionate about health. We are not professions. This is not our profession. We don't claim to be, but what we are is passionate about being proactive with our health and those around us. And of course, we want to be able to invest and to add to you or add value to you in this way. And so we have many different topics we've spoken on the last 9 months or so. It's been an initiative that we decided upon doing and to commit to. So for those of you who are reoccurring as guests, welcome again. And for those who are new on the call, welcome as well. And as we're speaking on the topic today, it's all about brain health, but it's specifically brain tumors or brain injury as well, because they sometimes have similar symptoms. But what I want to share with you is many of us may go through different challenges, which we don't realize can impact our overall health, including our brain. And so many things that are silent, many things that are obvious can happen just basically you may think by the snap of the finger or like a flick of the wrist in that moment, but really it's actually building up to some sort of condition that can impact your overall well-being. And so what I share with you today, you can take notes. We are recording this call for those that can go back and review it again. For me, repetition is key. It's so super important that we actually look into ways of being proactive, preventative. There's a saying we say back home, and prevention is better than cure. So if we're mindful of what we're doing, what we're thinking, all the things we know that are going to help us, then of course it will help us in our longevity of life. Of course, there's no such thing as living forever, but once we're here on earth, we can be the best version of ourselves. Right. So as I go through this with you, feel free if you have questions at the end to be able to ask it or put it in the comment as to what you think would be the best question that we can, well, at least try to answer to the best of our ability. If we don't know, we would also direct you to those who can help you with additional information, specifically around brain tumors or brain health. So as I share this with you, just want to double check on one thing here, just make sure you can actually see my screen. Give it a sec. Let's do that. One moment, and I'm going to go here, slideshow. Awesome. Okay, perfect. If you can see the screen, please put a 1 in the chat so that I can know that you're seeing the screen. Can you see the screen? Thumbs up, 1. Just want to make sure. Perfect. Thank you so much. I appreciate that. So as we go through these slides, as I mentioned to you, we're not health practitioners, but we're health enthusiasts. That's just information. I'm passionate about like collecting data and compiling it so that we can all be aware. So we know that sort of risk factor for brain cancer, but we're speaking about brain tumors, which can actually develop into brain cancer. Some are benign, some are malignant, but also knowing that it can impact your overall well-being, including your mental health. Also the silent signs of brain tumors, as well as things like headaches. So as I go through these slides, to think of things may pop into your mind, of course. So we know the brain is frontal lobe, there is parental lobe, there's occipital lobe, there is cerebellum, temporal lobe, brain stem. So all these are connected, and they actually drive how your brain function, how it responds, how it communicates with the rest of your body. So for example, your parietal lobe is like knowing right from the left, sensation, reading, and of course, to the frontal lobe for reasoning, speaking, the voluntary motor skills, and so forth. So this actually sort of gives you a guideline of how the brain tumor can actually impact certain parts of your brain and what can be impacted, not only the brain itself. So being mindful of the brain tumor or brain cancer, because as I mentioned, can develop into cancer. The things like severe or recurring headaches, vision loss, or seeing double can happen, and it's for tumors or brain cancer. if it actually develops into, a stage where it go into the cancer stage. But nausea and vomiting symptoms are similar. You could also have difficulty remembering, difficulty hearing or speaking, trouble swallowing or controlling facial muscles. Seizures can be one of the symptoms, of course, as prolonged unexplained fatigue. You're saying, I'm feeling so tired. I don't know why I'm feeling so tired. And, you may put two and two together, sort of make five, right? But how do you get brain tumors? There are certain things that we'll share with you to the best of my knowledge. I do know, for example, in my family, my uncle, he actually developed a brain cancer, but it didn't start from the brain. It started elsewhere. So I'll share that as well with you. And I have a friend who's have had brain tumors and have had lingering impact on her health, including things like severe headache going into like migraines. So in this case, some of the symptoms or common symptoms of brain tumors: headache, seizures, nausea, fatigue, cognitive issue, and sleep disturbance. Similar to brain cancer, right? As I mentioned before. So sleep disturbances can, as it's more frequent occurring, can be a sign that you're actually having or may have symptoms of a brain tumor. So brain tumor encompasses a wide range of types of, including both benign and malignant, as I mentioned before. Benign tumors are typically slow growing with clear borders and are less likely to recur after treatment. But malignant are often very aggressive, invading nearby tissues, and tend to recur after the treatment. That's the big difference, of course, leading to poor prognosis. So as we know, there's the studies have actually North America itself. It's more actually frequent in occurring than we realize, especially due to certain factors like race and so forth. So did you know that the different types of tumor types, there's over 130, brain or spine cancer are sometimes related or are connected. And there's quite a few cases per year. And this can actually increase depending on the sort of the perfect storm, so to speak, in your body and your brain. So excuse me, watching out for these signs and symptoms of brain tumor can actually help you to be more aware. So I mentioned before the seizures. There are many reasons why people get seizures, like epilepsy or other things. Medication can cause seizures, but in this case, we're referring to brain tumor. Vision problems is one of them. Loss of balance is another. Memory loss, as I mentioned before. Coordination is another one. Muscle weakness is also something else that is as a sign or sort of a flag as to maybe one of the symptoms. Feeling confused and disorientated, and tingling or stiffness on one side of the body is an indicator, especially in the neck area. So be aware also of the silent signs of a brain tumor. That if you have not been diagnosed as yet, or you think there may be something that's not quite right, and you haven't seeked you have actually spoken to or consulted with your doctor, if you have a doctor, a family doctor in your contacts. So one of the things that we can think of is the silent signs. For example, change in sense of smell is one. This tumor can cause changes in how your sensation, such as loss of smell or how you perceive certain odors. Another one is difficulty with fine motor skills, which impacts the part of the brain responsible for controlling the fine motor skills. So an example is if someone's having a stroke, they may lose the sensation in their hands to grasp. The motor skills are off, or their feet, the coordination. But in this case, brain tumors can also be similar symptoms as well. So part of the brain responsible for controlling the fine motor skills impacted, and that's one of the brain tumors that can actually impact that type of how your brain responds to certain things. So things like buttoning your clothes or even writing, small things like that can be a little bit off when you're thinking, what's wrong? What's happening? Persistent hiccups, believe it or not. While hiccups are common and usually not a cause of concern, if it's continuing persistent hiccups will last for several days, it's a sign of a brain tumor. Change in your appetite or your weight can happen, can also be a sign of a brain tumor. So it's responsible for regulating your appetite and your metabolism. That actually is connected. Balance problems. The brain tumor can impact the part of the brain responsible for balance and coordination, so that can result in your difficulty walking or standing. Basically, your motor skills, you're moving. And also for insomnia or sleep disturbances, this actually can impact you, can be a sign. So it's reoccurring too frequently. Brain tumors can impact the part of the brain responsible for regulating the sleep. So it can result in difficulty falling or staying asleep, unexplained fever or sweating. While fevers and sweating can be caused for a variety of conditions, this could be a sign of a brain tumor, particularly if they occur without any other obvious change, like it's too hot or in the house or too hot outside, or you're eating something that's really spicy. So that naturally occurs where you're having a sweating episode. But if you find you're getting onset of fever or excessive sweating, that could be an indicator as well. Increase in sensitivity to cold or hot or heat, sorry. So a brain tumor can impact the part of the brain responsible for regulating your body temperature. Again, I mentioned the different the areas, the frontal, parietal, and you have all the different areas that sort of signals to the rest of the body how to regulate itself, so to speak, and how to sort of communicate with the rest of the body. Changing your menstrual cycle for women. So brain tumor can impact the parts of the brain responsible for regulating the menstrual cycle, believe that or not. So which can result in changes in the frequency or the intensity of their period. Hair loss or skin changes. While not as common, some brain tumors can cause changes in the skin, your hair, like rashes, dryness, even hair loss can happen. From the cause of the brain tumor, the exact causes may not be not it's not fully understood, but possible factors include genetic mutations leading to uncontrolled cell growth, cancer elsewhere in the body. As I mentioned to you, my uncle passed away some time ago. He had cancer in the prostate, which went to his lungs, then went to his brain. Unfortunately, he passed away. So this actual brain tumor that we speak of can actually develop into can be cancerous. So the disruption of normal regulation of cell growth is what is impacting, and the mutation can be inherited or acquired over time. So what are brain and nerve tumors? They actually are connected, and so at some point there's a really relation between the two. So there's something called brain and nerve tumors. So the growth is abnormal in the brain. It also impacts the spinal cord and the nerves that branch from the central nervous system to the rest of the body. I mentioned the brain sends out signals of how the body's supposed to function and to flow. And so not only is it just your brain, your central nervous system is impacted as well. So while your motor skills, everything is also sort of impacted. So there are many different types of brain and nerve tumors. So we have, as we mentioned before, the tumors can be benign or they can be malignant. So the common include glioblastoma, schwannoma, neurofibroma, and neurofibrosarcoma. So those are the four types that can actually impact both the brain and the nerve. So primary brain and nerve tumors originate within the brain and then impacts the spinal cord. So like a double whammy, so to speak, unfortunately. So secondary tumors begin in another part of the body and spread to the brain and central nervous system. So in this case, it's the reverse. It starts from the spine and goes up to the brain. There's actually a link here on the foundation. I found some of the information. You can actually go into that and get more information on further expansion on that topic. Another thing as well is to consider, can stress cause brain tumor? We know stress is a silent killer in like heart attack and stroke, mental stress, mental disorders. These are the things that we've heard about, but can start the long journey of going towards brain tumor if not checked. As I mentioned about silent killer, stress is one of those. So one of the most frequent misconceptions that stress can give rise to brain tumors is that's sort of like a myth. But though stress can cause brain tumor is a regular query, one should make clear that stress will not directly contribute to brain tumors, but it can worsen underlying symptoms or complicate it even more. So especially if you've been diagnosed or you're having all of these symptoms and you're not sure as to what's happening with your body, undue stress can be placed upon your body, especially if you're in that situation of the unknown, waiting for a result, or you're having you've been diagnosed, that can trigger other things and sort of exasperate what you're going through. So stress management is crucial to overall health, not just in this situation, but your overall well-being, and it can assist in enhancing quality of life throughout the treatment process if you've been diagnosed. Some of the signs of the signs that you may figure that you have a sense of hopelessness, or you feel that, you're at there's no turning around, but the right mindset, the right way of approaching it can actually have a major shift as to how you sort of go through this journey of being after you've been diagnosed, or you think that you may have these symptoms that could be brain tumor if you haven't been diagnosed as yet. But it's also necessary to know rather to not know, to face it onward so that you can either alleviate that stress from your body and your mind, or just sort of move forward, with faith, knowing that, you can actually go through this and to be able to get the right support when needed, the right therapy, the right consultation, the right, community of people who can support you as well as your immediate family. It's necessary to consult with a doctor instead of believing stress is the issue, because you may have people who have, these sort of myth, at least the way of thinking that sort of compounds the stress because of the conversation you're having with them. So of course you guard your mind, you guard your heart, so that you can also protect yourself as you're on this health journey of improving your health if you've been diagnosed with brain tumor, or if you know someone who has had brain tumor and has the after effect, the aftercare, but they've been diagnosed with that. So for the signs of stress that can cause brain tumor, while feeling stressed or anxious sometimes is completely fine. That's sort of like mild stress. Stress signals your coming risk to help you avoid the situation sometimes, so that's normal. But studies suggest that long-term stress, like chronic stress, develop resistance in the immune system. You may hear from people from time to time, well, this person had such and such disease, but really that's not what they pass away from. They pass away from pneumonia, or they pass away because their immune system has been compromised. So, or during the process of, getting treatment or being diagnosed, it's important to know how to manage your stress or have the right coping skills so that you're able to sort of help yourself in your recovery. So think of it this way. If you have tight control of your thoughts, emotions, and action, actually helps your brain to sort of calm down and to be distressed and to be able to, of course, you're thinking right, you're making better choices. Versus when you have a weaker control of thoughts or emotions and actions are sort of out of whack because you're sort of having moments of anxiety, of stress, maybe anger, that can cause you to have a long-term stress, being a long-term stress or stress mode. And so protecting your immune system is super important. That promotes your current, the fact that if you have long-term stress, it promotes the occurrence of brain tumors, reoccurrence or occurrence of brain tumors. So stressful time is difficult to live as you live healthily, but knowing and to be mindful, knowing that this can impact your overall well-being, think of these things that are not conducive to your health or your health journey or your well-being, how it affects your mind, your diet, your physical activities, and so forth. So how one of the things was what I mentioned to you, I have a friend who has, excuse me, who developed migraines, severe migraines. And it can it triggered from all she had to have surgery to remove the tumor. Thankfully, it was not malignant. Um, the fact that migraine happens to some, and some may have actually a brain tumor that triggers migraine. There's a difference. So you can sort of think of it this way. If you've ever had someone who has migraine or migraine sufferer, or you yourself have migraines, there's a big difference, right? So there's the duration and frequency is also important to be aware of. So typical migraine patterns include things like, for example, 4 to 72 hours without treatment. That's where the pain is continuous. Pain-free periods between attacks, you sort of measure that. Predictable pattern where brain tumors headache tends to last for days without full relief. for more frequent and severe over time, show up in the morning or wake people from sleep. So the headaches or the migraines or triggers that mode, whereas a brain tumor headache sort of wakes you up in the morning from your sleep. Excuse me. Another warning sign that may indicate a brain tumor over a migraine is the medical attention becomes urgent to the following situations. So severe headaches, sudden change in pattern of headaches. For example, you may have a cluster headache migraine versus, combination migraine. You may have different types of migraines depending on what you're going through, severity of the migraine or headaches. The headache itself can wake you up consistently, or it keeps getting worse without any type of relief, any break. Headaches along with seizures, fainting, and walking difficulties. That's an indicator for a brain tumor, or if you've been diagnosed with some of the symptoms you may experience. So, how to differentiate between a normal headache and a brain tumor? There's certain triggers and relief. So, what sets off each type of headache? It determines the different factors. So, for example, common migraine triggers can include specific food, alcohol, caffeine, stress, lack of sleep, or even hormonal changes. For example, you're having your monthly cycle, a headache can happen because your hormone can fluctuate. You may have chronic stress or mild stress, or if you're lacking sleep, especially if you're going through the season of life and you're changed as a woman. But different things can happen, can actually trigger these types of headaches. Bright light or strong smells in the environment that can trigger your migraine. Migraines usually get better with specific treatments and rest. Brain tumor headaches may appear without any trigger. And so it's very hard to control how it comes, or the time it comes, when it reoccurs, whether you're at work, or if you're driving, you're home, you're sleeping, it wakes you up. Barely responding to regular headache medication. So you take that medication, it's not doing anything for you. You feel worse while lying down or bending forward. This is one of the indicators for a brain tumor headache. Uh, there's also a relation between those who've had, if you've at risk for a brain tumor. There's an increased risk of stroke in patients with head or neck cancer or tumors. So, for example, of course, we know we have, the central nervous system, everything is connected. Let's say you've been diagnosed with a brain or a spinal cord tumors. This may increase. So, you've been diagnosed, you've had your treatment, you're in recovery, and some people have actually had strokes after they've had the brain tumor treated, and they may be in remission. So that's also to speak to your doctor about, to be mindful of. The risk factors for brain tumor can be a combination of different things or isolated. So age, family history, exposure to radiation, genetic factors. So the risk factors for family history for brain tumors can happen where certain genetic syndromes may have an increased risk of developing brain cancer themselves. Your age, while brain cancer can occur at any age, the incidence increases as you age, especially with elderly individuals who are considered being higher at risk. And so exposure to the environment, age-related changes, cellular changes, of course, as you decline as you actually age, you increase in your age, certain things can decline, like in your health, like your immune system, your cellular process, how things happen with your communication with your brain and your rest of your body, including your central nervous system. Exposure to long-term chemical and radiation can happen. And so these are things you want to consider. Another factor for risk factor of brain cancer or brain tumor, consider this, that there are certain conditions, like scoliosis is one, as a one of the conditions someone may have, which is more common than we realize, especially in younger people who have been undiagnosed with sclerosis. These type of genetic disorders can actually be related to brain tumors and can be undiagnosed for a very long time because the focus is on sclerosis, for example, not the brain. And so exposure to doing these type of tests is limited depending on your age. They have to do certain tests on you. Your age might be a factor, as you may not be a candidate to have certain tests because of your age, which could be a younger age to not have the ability to have these type of screening. So only 5 to 10% of brain tumor patients with a family history of disease has been identified. Testing, counseling is important. So be your own advocate, push for that, especially if you have a family of cancer, not just brain tumor or brain cancer, but also to sort of have everything checked at least once to make sure you can rule that out. So different forms of brain tumors are common in different races. For example, in Black individuals, gliomas are more common in white people versus, Black individuals. Uh, Meningiomas is also more common in Black versus other ethnicity. And there's also, think of it this way, as other types of radiation. So, ionizing radiation, mobile phone radio frequency, waves, hazard chemicals. We're exposed to environmental risk factors every single day from the time we're born to the time we pass on this earth. So being mindful of the exposure you have for radio frequency waves, the type of radiation is also important. This is why at the younger age, X-rays are not recommended for young kids up to under 18, frequent very exposure to X-ray, especially if you're going to the dentist, so you're going to have X-ray because you've had an injury. Those are things that they have to factor in. So secondary brain tumors or metastatic tumors can spread to the brain, as I mentioned to you from, in my case, with my uncle. It can spread to the brain from cancer of other parts of the body. So in things like from the breast to the colon, the kidney, lungs. In my uncle's case, it was from prostate to lung to brain. And unfortunately, passed within 2 years of being diagnosed of having prostate cancer, which actually was in remission and came back after 5 years. And then this happened with the downward spiral of his health and unfortunately claimed his life. And this was actually on my maternal side. So the other complications that you can factor in for brain tumors, it's peritumoral edema, so it causes swelling of around the tumor, known as it is actually known as peritumoral edema. So it occurs due to increased fluid accumulation in the brain tissue. So surrounding the tumor, the swelling can happen, leading to neurological symptoms, for example, like headaches, cognitive changes, and weaknesses, as you mentioned, the LV as well. Seizures, the disruption of the brain, can have seizures that are common in manifestation in patients with brain tumors, occurring as a result of abnormal electrical activity in the brain. So seizures can be focal, affecting specific areas of the brain, or even generalized. It's involving an entire brain. So it depends on where you've had the area of your brain has been impacted, can be an indicator of how your central nervous system is impacted, your motor skills, all of that, your speech, everything, because you've had a seizure, which is related to a brain tumor. Depression, of course, if you've had a stroke or even diabetic related stroke, or you've had stress-induced stroke, could happen, many things can happen. But once you've had a health scare or health condition, depression comes in as a secondary condition because your mood alters, how you feel, how you perceive things changes. So your depression happens, and sometimes you don't realize you're depressed. So the emotional impact of the brain tumor diagnosis, the subsequent treatment can lead to depression and affected areas, affected individuals. So coping with uncertainty of illness makes you have this feeling, or can actually have this feeling of hopelessness, and also feeling that things are out of your control, so to speak, which can actually have a spiral effect of you falling into deeper depression or anxiety. So being sad, all these things can be a factor or indicators of depression. So there are different types of brain tumor. For example, it's in most condition is stage 1, 2, 3, and 4. So stage 1 is usually not cancerous and grows very slowly. Brain tumor stage 2, a warning stage. So this is sort of, you have certain things that are getting worse. So it's a low grade. So your cells look abnormal versus the normal stage of growth for your cells. Your tumors may start to spread to nearby tissues, could come back after your treatment. And so the brain stage 3 would be when it turns dangerous. It was cancerous and grows quickly. So cells that are obviously cancerous can attack nearby tissues, spreading very quickly, more likely to come back to reoccur even after treatment. So stage 4, brain tumor, the advanced phase of the stage 4 brain tumor is the worst and most aggressive type. So stage four, the key features are cell growth and spread very quickly. Hard to get rid of completely, often spreads to other parts of the brain and spinal cord and other organs as well. So as you see, a screen capture here of the different types of stage one to stage four. Also, another factor indicator of your optometrist of identifying that you may have a brain tumor. I apologize. So just sorry about that. So the optometrist is also a in the indicator that could be a key person to help you to identify if you've had a brain tumor or something happens. So for example, if you have a vision impairment or you find that you go to your eye exam, they may do a more intense or comprehensive eye exam, and they may find things in the back of your eye that can be indicated that something's not quite right. So when you're doing all of these type of eye care, at least every 2 years or so in adults and every year in kids, I believe, as you get older, especially if you've had diabetes or some other condition, they may ask you to come every year. But for them to do a comprehensive eye exam, they're looking at the back towards the brain, so they can actually see this pressure on the optic nerve. And that could be indicated something is wrong. And of course, they may not be able to diagnose brain tumors happening in the back of the eye, but they can actually recommend you seeing your doctor to get further consultation for a specialist to determine if this actually could be indicated that you have a brain tumor. How do eye tests help diagnose a brain tumor? Well, during that, I mentioned before the physical exam, they actually do certain things to dilate your eyes, the back your pupils, to be able to check the back of your eye. So, when they do this, they identify through these dark spots, including blurring, and they do certain type of tests that to ask you if you have double vision. So these type of signs as well. And so these are um, signs that the tumor has damaged or is pressing on some parts of the brain that can facilitate the eyesight. As I said, everything is connected. So aside from the brain tumor, eye exams can reveal other health concerns such as diabetes, hyperpressure, autoimmune disease, and thyroid problems. So not only for brain tumor, but other things that they look for when they do a comprehensive eye exam. So the neurological test is also a way that could be utilized to help diagnose a brain tumor. So it can help to sort of narrow it down as to the type of tumor you have based on these type of testing, and that may require further testing. So it can affect your cognitive function, your movement, your reflexes, coordinations, and so forth. So because it's damaging your brain in a certain case, and so it disrupts certain parts of the brain that helps you with your day-to-day activity, your daily life. So a series of in-office neurological tests can actually help you to, not you, but whoever's doing the test to diagnose if you have or have not if you have or do not have brain tumor. So how do you diagnose it? Well, if the brain tumor is suspected following a physical exam or even an eye exam, the health practitioner could actually have a certain type of test done, which is MRI, to scan your brain, and if a mass is found, a biopsy is required. From the biopsy, they'll be able to take certain tissues to identify if it's a benign or malignant, and so that way you can actually be proactive on helping you with your wellness and improving your health if you've been diagnosed with a brain tumor or someone you know. So besides a physical exam, MRI or CT scan, checking the lumbar puncture is a test as well that can happen. Hormone blood test, which could be the simplest way to do it, or biopsy. Also if you've been diagnosed through these diagnosis, a routine check or test, treatment is also would be recommended. And of course, that's based on your conversation you're having with your family doctor or doctor you're seeing. Surgery, radiation, chemotherapy, targeted drugs, therapy. Of course, you speak to that individual who you're consulting with. And I would also recommend speaking to a naturopathic doctor in addition to your traditional family doctor, so you can get information from both sides to assess what is the best route of treatment for you or the person that you know has this condition. So can you live a normal life with a brain tumor? It is possible. Even though it can be challenging, it is possible depending on having the right mindset, doing the right things to be able to minimize the recurrence of some of the symptoms you're experiencing. So how do brain tumor affect your life? Well, we are what we are because of our brain. That's how it works, right? The brain dictates the rest of the body. So which regulates our consciousness, our movements, our emotions, our feelings, our thoughts, our speech, our intelligence, our conduct, and our memory. So as a result, the brain tumor can impair all of these activities and have a catastrophic, life-changing physical and physiological impact on the person's life and their family. So not only are you going through someone you know, the family, the people around you have to be mentally prepared or at least educate themselves together so that you're able to have that safe environment to share how you're feeling without feeling that you are bogged down with these type of emotions when you can't express yourself or how you're actually coping with your day-to-day life. So the brain tumor may not affect people of various ages from babies to the elderly, can, but depending on your stage of life, then you're actually able to articulate better how you're feeling so you can get the right resources to help you to speak with, to be able to counsel with, to be able to care for, and to have that ability to be able to express how you're feeling so you're not feeling overwhelmed. And there's actually a direct impact with brain tumors on your mental health. So, as I mentioned to you, in any condition you may have, any sort of health condition, health scare you've been diagnosed with, your mental health is directly linked to that. I can share with my cousin who didn't have brain tumor, she had breast cancer, with the counseling session before her radiation that she did, sitting with her because I took her to all her appointments. The question was, how are you feeling? Do you have suicidal thoughts? Are you feeling depressed? Are you feeling sense of hopelessness? They don't sort of put words in your mouth. They ask you and then wait. And then, of course, they may ask certain questions. But if anything you're doing, that impacts. Even with my mother, who had her first scared with diabetes related stroke, same questions. Depression, how's your mental state? How do you feel? So every stage of life that you've been impacted with your health, mental health has to be checked because that cannot be ignored. So the brain tumor significantly impacted the mental health. It can cause, many things like anxiety. You may not have anxiety and you develop anxiety. You may have, your mood may change from not being aggressive to being aggressive. Your personality change can happen. So you may have your patience, you may not be as, you may not have moments of apathy. You find that the things can alter your mood, your being itself, and it's controlled by this your brain tumor that you may have. So the pressure or swelling in specific brain areas, such as the frontal and temporal lobe, has a great impact on these things. That's your mental health. Below, there's some links here from PubMed and also from the Duke University of Education blogs. I've actually have them here, so you can actually do some further reading. But keep in mind as well what you can control today. So, for example, things like an imbalanced diet. Sometimes we get stressed, so we tend to go to the processed food for comfort versus making healthier choices. So you can actually have a negative impact on your recovery or your treatment process whilst you're going through this health care. So being mindful of that, reducing your stress, eating the right things instead of gravitating to imbalanced diets, so planning ahead can actually help with your mood, your mental state, how you approach things. So being overly stressed, we make poor choices. When you feel really fatigued, we make poor choices, especially if our sleep is impacted because of you've been diagnosed or someone you know been diagnosed with a brain tumor. So intake of high energy food is important. Foods that have the right amount of supplements, in the way of antioxidants and nutrients and minerals and vitamins is important. Also knowing that you're going to fuel your body with the right food, but the right food with the right nutrients to help balance your state. Imbalanced diet leads to increased oxidative stress, which is not good for your body. It also leads to insulin resistance, which is not good for your body. And it can change many hormones, which play a key role in the pathogenesis of many cancers, including the brain cancer. Smoking, you may be diagnosed, but you're a smoker, whether it's infrequent or frequent smoker. You're stressed. What do? You gravitate to the habits that are not conducive to your health. So you may increase the amount of times you smoke, especially if you're trying to deal with the mental challenges. You may become overly anxious or depressed, so you gravitate to a nicotine temporary stress reliever because the brain sort of works that way. So however you decide to approach your journey onto the better version of yourself in your health journey, be mindful of these things. Also, alcohol. So again, it's a coping skill, a coping mechanism. You'd have to sort of shift from the habits of, let's say, excessive alcohol consumption. You may be stressed and you gravitate to things that sort of temporary fix in the way of smoking or drinking or overeating, food that are not highly processed. But it alters how your brain processes things. So it slows down the processing of the brain, the good function of communicating, basically communicating between the brain and the nervous system. The alcohol impacts it in a negative way. So you're healthy or healthier and you're consuming alcohol, and it actually impacts you that way, much less if you've been diagnosed with a brain tumor. Again, it sort of amplifies your decline in your brain health because you're doing things that you're not feeding your brain and your body the right things. So not to judge you, just to advise you, if you know someone who's consuming a lot more alcohol because they're stressed and not speaking about what's happening with them, they internalize all of that by making the poor choices that will have a negative impact on their journey towards a better health. Low physical activities, stress or anxiety can lower your energy, especially if you're not sleeping and you're thinking and consuming your thoughts with, this brain tumor you may or may not have, or you've been with someone else who has it very close to you. Think of how you can combat that by taking and sort of incorporating physical activities with you or a group to get your mind out of that state, to be able to release some of the toxins because you're moving and you're thinking differently. So your energy shifts and your way of being shifts because you're not thinking in sort of a downward spiral emotion of negativity, but you're actually working towards a better you by being more active. So think of it this way, if you're not physically active, more toxin can build up in your body. You're not releasing it. Your metabolism slows down. Your immune system slows down. You have a higher risk of obesity and hypertension and diabetes. So all of these things compounded, but all of these things compounded can actually lead to a brain tumor. It can actually create these are factors that can cause brain tumors. As we mentioned, the elderly, as you get older, you're not as mobile, you're not as active, and of course, less oxygen in your body and brain. You're not moving right, you're not eating right, and what can happen? These are perfect storm in the body that can actually trigger a brain tumor. Of course, if left undiagnosed, unfortunately, that would be, a sad thing to happen if not diagnosed correctly. Nutrition is important in the fact of eating right, eating foods that are really rich in nutrients. We know that food on the planet is heavily depleted in the nutrients, so I would like to maybe suggest superfood, including superfoods into your body. Things like, for example, in our world, in our family, we consume reishi, which is actually one of the top superfoods on the planet that's been on the hierarchy of all medicinal and food supplements on the planet. Not by me, but by researchers through, for example, PubMed Library, where they do research different types of herbs and fruits and superfoods that can help the body get the right nutrients it needs. Things like spirulina, goji berries, all these things are really good to have. But this is in addition to you eating the right way, the clean way, and reducing and minimizing processed food as best as you can. So think of it this way, you're consuming food for your energy, but you're not getting all the right nutrients. So what if you do incorporate things like turmeric or probiotics, lion's mane, cordyceps, omega-3s, vitamin D3s, all of these things. And so we're consuming this to build up our immune system or to support our immune system whilst we're going through this health journey of, let's say, a brain tumor. So I mentioned before things like low energy, not able to sleep, your healing capacity may be diminished. You may have bouts where you're feeling overly anxious or stressed, and you're eating a superfood that can help you to alleviate all of that. Now, eating the right food for the right source of nutrients is super important. So be mindful of your journey. So as the best way I can explain it is If you love avocados, which for me, I don't love avocados, but my family does. So avocado could be very high in nutrients, especially for brain function. And you may say, okay, I'm going to eat half of an avocado. Well, you need 7 whole avocados to get the equivalent of 1 dose of the Cannabis, which is also called reishi. It's very high in antioxidants. I'll share with you some findings that I found. If you love green tea like myself, I may have 1 or 2 cups a day, but I can't have 54 cups of green tea a day, right? But we know that green tea is anti-cancer on its own. It also is very high in antioxidants. Whereas you have the reishi, you may have 1 single dose to have 150 of the, sorry, 150 antioxidants versus, you need to have 54 cups of green tea, right? So think of the things you're consuming over time. Your body will sort of perform in a different way. Your brain will function a different way. Your cognition can improve because you're giving your body the right nutrients and the right type of foods in the way of supplementing what your regular food is depleted because of the soil. So medicinal mushrooms are very high, and I consider on the table for medicinal and food supplement in the nutraceutical world. Very high in nutraceutical properties, very low in calories and fat on the whole. It's mushroom. So we know we have those that we can cook with, and there's those that you can actually have as medicinal. And fortunately, this is actually classed under both. So a very high rich source of nutrients and bioactive compounds. And we know that because of these nutrients, these vitamins, they can be used as treatments for many ailments. So things like antioxidants, terpenoids, flavonoids, especially flavonoids, which actually helps to, it has a neuroprotective and cardioprotective effect on the body. Flavonoids in most foods, even though you're not getting the right dosage per you as you're eating your consumption of food, is actually helpful in areas like it's anti-cancer, antioxidant, anti-inflammatory, antiviral. So you're eating the right foods. You can call leafy color fruits and vegetables and proteins, all these things come together can help the body heal itself because we know that the body can heal itself when given the right things, right? So when given the right things, the right nutrients, it's a great way to be able to support your brain and your body function. So here we have the sources, PubMed.gov. PubMed.gov is a public medical library that's been documented over 3,000 case studies of this superfood. And I never heard about it. 14 years ago, never heard about it. I had an aunt who passed away from, Pick's disease, which is a form of dementia, and ALS. And we searched and searched and searched, and we just couldn't find anything. And unfortunately, she passed away. It's an anomaly because of her ethnicity. Getting both is very rare. And 3 weeks after we laid her to rest, this was introduced to me as to this particular benefits of this because someone shared their story with me. And I really got angry, but I was very thankful because I know you're mourning your lost one, your loved one, but on another hand, you see this potential of this Eastern grown medicinal mushroom that we want to introduce to ourselves, our family, and also share with the world. So not only is it helping with getting rid of free radicals in the body, it actually reduces oxidative stress in the body because oxidative stress in the body increases your risk of illness. So your body getting the antioxidants to alleviate the free radicals and to alleviate oxidative stress can help with brain functions and many other things. Not only is it protecting your immune system, also with your brain function, sorry, it has a lot of antioxidant that not only helps with, that part of your well-being, but also possesses the ability to help you with your depression. It doesn't matter if it's a brain tumor, but other type of condition. It's been proven for that. But Ganadum on its own is quite bitter to taste. But if you're like me, I don't do bitter. I found ways I can consume it without the bitter part of it and still benefit from it, which I'll share with you in a sec. So the Gandam lucidum preparation may have certain protective effects on the immune system, the nervous system, and endocrine system. So we talk about the nervous system. We talked about the brain tumor, the spinal cord, and impacting the central nervous system. This has been proven through this PubMed study, through different studies to show how it actually improves and helps with the recovery or also alleviate certain things. The antioxidants, inflammation, oxidative stress. We know these are they can't in the body you can't have oxidative stress if you're taking the right antioxidants. If you're taking the right nutrients, that diminishes. So think of it as you giving your body certain things to regulate your nervous system, to help with your neurodegeneration, neuroprotection, and also your secondary metabolite. So all of these things actually are working with your body to help to, like an adaptogen, to help you to improve your well-being, including if you've been diagnosed with brain tumor. Now, another thing as well is that we know from different studies, over 3,000 plus studies, as part of the studies, that it's been proven to improve cognitive impairment, alleviate neuronal damage, so basically your neurons. And knowing that you can actually protect it or actually improve it, or to be able to help you to repair what needs to be repaired if damaged, it's actually a win-win. So those individuals who've been diagnosed with brain cancer or brain tumor, this can actually be a source of an option that you can actually consider in addition to what you're doing with your regular therapy. Uh, Actually helps with anxiety, works like a sedative to calm you down, especially if you're going through chronic or mild stress. We talk about stress being an indicator that can actually help to negatively impact you if you have a brain tumor. It actually helps to alleviate depressive disorders or behaviors. It is in treatments of restlessness, for example, insomnia. It helps with aiding sleep, your memory impairment. We see anti-aging, but prolonging of life. That's the main thing. It also helps to relax your when you're sleeping. I mentioned before when you have been conditioned with the diagnosis with brain tumor, that your sleep can be disrupted. But if you're consuming something that can calm your body, help you to get to a deeper sleep, and get you to that REM sleep, so that your body gets enough time to repair itself, including your brain, you are actually giving a win-win because you're consuming something that has a high amount of nutrients. That's considered a food supplement because you can't overdose on food, and a medicinal supplement that has no negative interaction with any medication that have discovered for any condition that you may have. So we also spoke about different types of supplements or nutrients. I mentioned cordyceps and lion's mane. Well, cordyceps on its own works well. Ganoderma on its own works well, but you can synergistically take them together and you actually have additional support for your well-being, including your brain tumor or brain health. So we know that with Ganoderma, it is in the treatment of, I mentioned before, insomnia and restlessness, but there's different stages of how the Ganoderma grows. So the mycelium are the roots of the actual herb. You're looking at the fruiting body, which is the Ganoderma itself, and then the seeds, which is called Ganoderma spores. Very potent, very powerful in the way of results, in the way of your body consuming it. That actually aids in sleeping improvement. Also, you can find that other information through PubMed that can help you with getting more information on sleep, insomnia, and so forth. And so for Ganoderma itself, we mentioned about anti-inflammatory properties, antioxidant properties. Not only that, it also helps with your metabolic disorders. So, for example, we know that part of the brain regulates your metabolic state. That actually helps with that, helps with the cardiovascular disease. So we know that with the brain, it's not functioning, it's not signaling to the rest of your body, can impact your organs, not only your central nervous system. So these are overall things that can help you as well. The most important thing that we want to talk about is neuroprotection. It protects the brain. So your body has oxidative stress. It happens to us from time to time. So if you're consuming something like this, it helps to protect your brain. It helps with your regeneration. Also, improves the spatial memory ability, and it's considered anti-tumor as well. So what is oxidative stress? Well, you have a normal cell. and then the free radicals attack the cell. And then the cells that are being attacked can basically change from normal cell to cell with oxidative stress. That's what happens. So if we can manage our brain in the way of the reducing oxidative stress by consuming something that will help you in that capacity to protect against oxidative stress, whilst you're either going through a treatment for a brain tumor, if it's considered benign or malignant, whilst you, if you don't have a brain tumor, but also for your brain health, that is something you can do as well. In a way of consuming that to protect you, being proactive or reactive, depending on the stage of where you are. And knowing that you're protecting your brain as well as your body is a win-win because you're giving yourself, your body, the right things. So I mentioned before, with Ganodum, it supports with better sleep. So does cordyceps. Cordyceps actually is a very powerful mushroom on its own. It actually supports your energy level. It helps with your stamina and your endurance. I mentioned before, if you've had a brain tumor or been diagnosed with it, or you know someone, you will have increased level of fatigue, tiredness. You're not able to sleep. You feel tired, but you can't sleep. You sleep, you still wake up tired, more fatigued than normal. So what this does actually helps to release certain things in your body, like the oxidative stress. Also helps to improve your symptoms of depression, improving your sleep, alleviating the chronic mild stress, just like the Ganoderma, so you can take it on its own or together, and I'll share with you how I'm able to do that myself. And also it helps with many other things, including your memory. It also helps with your, I mentioned before, with my uncle that he passed away. Unfortunately, there's nothing we could have done. At the time, he was stage 4 cancer in the brain. He actually what we noticed about is that one thing is that his memory was impacted because of that. So knowing that the cordyceps can help with improving your memory and sleep, antioxidants that can help you with your overall well-being and anti-inflammatory, for me, it actually, I love this because it's something I've been consuming for some time now. So not only it has immense health benefits, it also has many other components that can help you, like neurodegenerative diseases, neuroinflammation, neuroprotection, neurotrauma. So if you had a brain injury, oxidative stress, all of this actually helps to alleviate all of this over time. So studying how the cordyceps improves the sleep symptoms is what was proven in some of these PubMed studies in patients studies over time. And this is actually on the focal part of what they were focusing on in the way of consumption and the results. And so the fact that we have different conditions like seizures, you have other symptoms that I mentioned before. This has been proven to be to help with anyone who's gone through epileptic or even a seizure related to the brain tumor. It actually helps to minimize the frequency or to reduce it or alleviate it. Excuse me, sorry about that. And the other thing as well that I mentioned before, same with the Ganoderma, it helps with depressive disorders, chronic mild stress. Last thing I want to mention to you is this other herb called lion's mane. Lion's mane I actually love as well. I just started consuming this about, I think, 2 or 3 years ago as a blend with the other two. I found that my cognition has improved, and I found in this case it's really eye-opening for me because on its own you can consume it or together synergistically they work together. So this it functions focuses on the brain. It focuses on your brain and your gut communication. So it's great for your gut-brain axis. That one is key. Of course, your brain is signaling to the rest of the body, especially your gut, where you have your we call it gastrointestinal, which is your where you store your emotions. It is anti-cancer, antimicrobial, antioxidant properties, actually helps with reducing oxidative stress, which we keep saying oxidative stress. There's a reason for that. So we are seeing significant improvements in this type of behavior, recognition with objects by consuming this. It's so many other benefits, anti-cancer, anti-dementia, and many other things. And the reason I share this with you as a wrap up here is that we discovered these three through this company called Organo. And so we want to we're representing this particular brand because we love what it's doing for our family and those that we're helping with consuming this. And so we discovered it with this brand. We want to help people create better lives, healthy and richer lives. And we know for one thing for sure, it supports the immune system, but also helps to fight infections and diseases. So the ours is naturally grown organically. There's two ways of it growing, plastic or natural. Ours is grown in Mother Earth, where we have all the certification. Although artificially grown is still considered, certified organic, we know that but that's not what we want. This is the brand that I'm so in love with. I love this, and for me, as I mentioned, I love the effects and the benefits I'm receiving with myself and those that we share it with. But consuming something that your palate likes, like coffee or tea or mocha, sorry, hot cocoa, I'm saying mocha because I like mocha, or in the therapeutic form. That actually is really good because you can choose how you consume it and how your body responds. Because if you like something, you're going to gravitate to it. So I love these. I get all of my nutrients, and I'm sure you will be benefit this as well. But practicing mindful positivity through wellness is super important. Your mind, your body in alignment, your brain, making sure that you're giving it the right things, having the right thoughts. But just making one small change can be a lasting effect. And as I mentioned to you before, these are the three. They can work individually or synergistically together. This is how it comes in the capsule form, therapeutic form, the three stages of growth I mentioned before. So think of it. You want to be able to practice wellness in giving the right nutrients. So think of Ganoderma supplements as your passport to holistic wellness. As I shared that with you, I mentioned the three stages of the Ganoderma. This is one of the products I'm in love with. It has the three. This I mentioned about the cordyceps, lion's mane, and the Ganoderma. That's one of my new favorite, and I found I can feel the impact, the influence on my system because I'm consuming the right things. But knowing that for one thing it actually does is to help fight stress. It's one of the things I spoke about before. So as I wrap up, we actually have the tea forms as well. This has the cordyceps and the mushrooms. But I believe there is, if you would love to give yourself the opportunity to try or to switch your brand at least for 30, 60, 90 days just to see what it does for you because the body doesn't lie. I would encourage you to get a box or two. Right now there's a promotion, a limited time, in the North America, US and Canada. You can actually have it shipped to your location. Doesn't matter where you are in North America, it can be sent to your home or your office or another location. You can even gift it to someone, and the shipping is free. After a certain time, the offer comes off the table with the free shipping, but it's something that our company is actually offering, so you can actually enjoy the benefits right away. In some places, it's 3 to 5 days to ship to you. Some places 5 to 7 days if it's placed on a weekend. So with that, I would love to open up for any questions that you may have. I see some comments here on the chat. And if you'd love to ask a question, you can place yourself off of mute, and I'll be more than happy to answer as best as I can.
Good night, Kerry-Ann.
Good night.
That was some great information.
Thank you.
Just a couple of weeks ago, Jeremiah, my 15-year-old, he was having some seizures at night due to stress. He had lost a loved one from his classroom, and
Mm.
he couldn't deal with the stress. And his father called me and he said that he was having some seizures at night. So right away, I ordered the mycelium, and he's been taking the mycelium. I asked his father if he's noticed any changes, and he said that Jeremiah hasn't been shaking at night. So I'm like,
Well,
okay, that's great. That's great. So he's been taking them for like 2 weeks so far. So good.
awesome. And did they do a test just to confirm how the seizures were started?
Well, the doctor put a referral for a neuron for the brain test,
Mm-hmm.
and we're still waiting for that call.
Okay, it takes a while.
Yeah.
Any type of specialist can take up to a few months. But I'm happy to hear that he's not experiencing those symptoms. because nutrient, the body, when
Okay.
it has a symptom, it could be deficient in a nutrient. And I'm not a specialist, I'm not a neurologist, but you sharing this experience tells me that it's doing something good.
Hmm.
I'm thankful that we're part of that journey with our company, Organo.
Yes, thank goodness.
Yes.
Thank
Any
God.
other questions? So thank you. You're very welcome. For those of you who are joining for the first time, thanks again. I appreciate it. We have a private Facebook group that we store all of our recordings on. And I have a YouTube channel that sort of adding slowly some of those content because a lot of people don't have Facebook. But I know repetition is key. So if you'd like more information on it, we'd be more than happy to speak to you one-on-one. And of course, give you as much information we can. If we don't have it, I have a mentor. We have a mentor called Dr. Bob Bukowski. He's a naturopathic doctor and nutritionist out of Houston, Texas, which we refer to all the time. So if there's a specific question you have, there's actually a monthly call. It's called Ask the Doctor. If you're interested in that, I can share the information with you. All right, so have a great day, everyone. Take care, blessings, and see you next time. Take care for now.
See you next
Night.
time.
Okay, bye-bye.